you're having glute pain and it's really intense. So it's possible that it's gluteus medius tendinopathy or something like that. Sometimes it's referred pain from the back, but today we're talking about gluteus medius tendinopathy. So the gluteus medius attaches a little bit lower than the iliac crest, which runs kind of over like this, kind of like that, kind of a horseshoe type motion, and runs down to your greater trochanter like this. So it's kind of a deltoid or a triangle, fairly deep, but mostly the tenderness hurts right about there and sometimes comes down all the way to the attachment on the greater trochanter right there. So gluteus medius pain can be quite intense and needs to be warmed up because of overuse. That tendon is degenerative a little bit, and that creates some swelling and irritation that needs to be warmed up like any tendinitis or tendinosis. What we would do to assess your gluteus medius tendinopathy or the pain in your lateral hip is we would take you through some range of motion tests. So we would test your low back range of motion, test your hip range of motion, and actually take a global view to make sure that something far away isn't causing compensation that is causing you hip pain or back pain that is referring into your hip. So we take a lot of different range of motion tests. Then we would do a neuro evaluation to just rule out anything that is more intense, more severe. And then we'll do some muscle testing to find out what muscles are firing and which ones are weak, which ones are tight, so that we can figure out what to loosen up and what to strengthen. And then lastly, a McKinsey evaluation, which will help us figure out which movements will help you help yourself. So that is the majority of the tests we would use to assess your back and hip, because we've got to always assess the back when you're having hip pain, especially gluteus medius, because oftentimes the back will refer down into your hip, and it makes it difficult to diagnose, but not impossible. Once we've taken you through a thorough assessment and we have a really solid diagnosis, especially if we're diagnosing gluteus medius tendinopathy, then we would start with the in-office treatments. So that would consist of chiropractic manipulation, so adjusting of your low back and hip and the sacroiliac joint, depending on what's restricted and tight. We would use active release technique or fascial distortion model or deep tissue massage therapy, kind of sports massage, whichever one we feel is going to be most effective for you. And then sometimes, especially with the hip, we would use dry needling because those muscles get really locked up, and to work deeply is difficult. We got to press really hard and work through some of the superficial muscles to get to the deeper muscles. So if you like needles and respond well, then we can use those as an option. So that's it for the in-office treatment. The out-of-office treatment, so your home exercise program, we would have you do different forms of exercise, so or what we call activity modification. So we would change the way you move, change the way you exercise, so that you're not causing yourself more pain. And that's where we have your help in loosening up what's tight and strengthening what's weak, so that we can get you better as soon as possible. So if you'd like help feeling better, we'd love to help. Give us a call or request an appointment online.